Ask us anything. Monday Motivation. Serena Chen is joining me in just a minute. I'm Alice Crisci, creator of the Fertility Answers app, and my dear friend and colleague, Dr. Serena H. Chen. There she is, the fabulous, the
Hi,
gorgeous.
how are you?
I'm doing great. I always want to check in with you though, Serena, on the vaccine as like the opening topic, because not a day is passing where we're not reading more and more in the news about how successful the vaccine is going so far. And at this point now, almost 30 million people, I believe, that have successfully been vaccinated, with many of them being pregnant doctors.
Yeah, so you saw it, did you see that?
Yes.
I think USA Today, I tweeted it and posted it that Dr. Fauci said of the more than 10,000 pregnant women that have been vaccinated with the messenger RNA vaccines, there are no red flags so far.
I did see that. It was so encouraging.
Just as we expected, but it's nice to actually have that people actually getting the vaccine that are pregnant and saying, yeah, I'm doing fine. So.
And, we have seen this now in the Fertility Answers app as well. Somebody in Los Angeles who said, my husband is concerned about our timing because we're getting closer and closer to the gen pop being vaccinated, and they're trying to plan their IVF cycle around it. And when it's a safe, now this is if you can get the Pfizer or Moderna vaccine.
Right, because
so the Johnson & Johnson,
yeah, it's coming out soon. I don't think they're going to say that it's okay for pregnant women. I really don't know, but I don't think it's been studied in pregnant women, which, of course, ACOG is really unhappy about. But it's a live virus vaccine. It's not a live coronavirus. So it's not a virus that actually causes disease. It's actually a very new type of vaccine. And the adenovirus just acts like a little delivery boy,
right?
But
which is not uncommon in science, but because it's a live vaccine, that's the one that people would be a little bit more cautious.
We haven't really tried that in pregnant women, so I don't think ACOG is going to feel the same about that vaccine as they do about the messenger RNA vaccine. So we're really wanting people to get the messenger RNA vaccines if they're trying to conceive or pregnant or breastfeed.
Yes. Now here's going to be the tricky thing. State by state, the vaccine rollout has varied wildly. Wildly. So then if you throw in that wrench into it and you're signing up for your vaccine and you don't know which one you're signing up for.
Yeah.
So I think that it's going to be very important for people to pay attention to what is being distributed and where.
And we're seeing confusion. A lot of states are actually banning pregnant women from getting the vaccine.
Which is terrible and completely against guidelines.
Yeah, that's against guidelines. And hopefully ACOG is going to, ACOG and ASRM and the CDC and the ACIP and Society for Maternal Fetal Medicine are all going to continue to work to get the word out about that, this is the vaccine we want pregnant women to get because they are higher risk. So, hopefully that will get the word out. It means it's been challenging. It's been really challenging. So.
Exactly. So Shelby, we will talk about whatever you want us to talk about. So normally the open forum, the way that it goes is Serena and I just dive into something we wanted to follow up on. And this is your chance to ask your specific question. So if there's something about POF that you want to talk about, the floor is yours. So that goes for everybody else that's on this live. Yes.
I wanted to bring something up because today, as people are getting vaccinated and the numbers, thankfully, seem to be going down for hospitalizations and things like that. I am seeing more of my patients travel, and Zika virus is still a thing.
Oh, wow.
People who are trying to conceive. So I haven't looked at the CDC Zika site in like a year, but I pulled it up today for one of my patients who is traveling, and it does look like the CDC still is recommending travel precautions, 3 months of condoms after you return from certain areas like Central America, Mexico, South America, like hot Zika places, India, things like that. So I think we still have to be aware of Zika virus because Zika can be really, really devastating in pregnancy. Like basically it's that virus that attacks the baby's brain, but you don't get sick, but it eats the baby's brain. So that is, I think, as travel restrictions loosen up, everybody should know before they travel, whether you're pregnant or trying to conceive or not, the CDC does a really nice job of giving you travel precautions. So there's two sites, CDC, and then I forget the exact site, but the TSA site, where, you know, like if there's an insurrection or if there's a bad infection, you know, the CDC will tell you all the vaccines you need and all the health precautions you need. And then the US government through the TSA will give you, you know, other safety precautions. So I think anybody that travels at any point, you know, before you get on a plane, look at those wonderful resources to keep you safe.
It's a really, really good point. I think we forgot that anything else exists in the world besides COVID.
Yeah, we have forgotten, and now, like, I think it's a good sign that now I'm thinking about like people traveling and what we have to think about when they travel.
Absolutely.
So yeah.
Yeah, absolutely. Light at the end of the tunnel. QS is asking, what would the LH level have to be in order to ovulate?
That is such a good question, because, you know, even this is a funny one, because sometimes when we're trying to predict exactly when to start progesterone and exactly when to do an embryo transfer, you'll have, at least at my practice, 8 doctors all just obsessing over the LH level. And the truth is, like 20 is suspicious, but it doesn't really always tell you.
Right.
So 15 to 20 will show up positive on an LH kit for ovulation, but we obsess over not just LH level, but the day of the cycle, the size of the follicle, the level of estradiol. Is it going up? Is it going down? Is the LH going up? Is it going down? Is the progesterone going up? Is it going down? What's the pattern? So you know, I would say like 25 or 30, you probably are ovulating, but I've seen people mount a response of 25 or 30 and then not ovulate for days later. And some people just never ovulate. So it's not totally black and white.
And can you talk about the extra complication of all of our audience members who have PCOS and their LH?
Yeah, because a lot of PCOS patients are always sitting around 15 to 20, which for people who ovulate on a regular basis might be a real surge, but for PCOS patients really is not a surge at all. It's just a high chronic LH, and which happens, you know, I'd say 30 to 40% of PCOS patients do have that kind of elevated LH thing.
That's a lot. That's a lot of people.
Yeah.
Shelby's asking a question on egg adoption and where to start. So I think the first place to start is that we don't see egg adoptions like we see.
Yeah, we don't like to say
donation.
adoption, because that creates all kinds of potential legal issues for people who want to get eggs. We just call them donor eggs.
Yeah, and there's you know, there likewise with sperm donors, Shelby. My son is a donor conceived child through sperm donation, and my egg. It's interesting because the legal pathway for donor conception is very clear, you know, and it's clear really state by state. These laws have actually been in legislation for quite a long time for sperm and egg donation. Yeah. Now, if you consider embryo donation, however, it varies state to state, whether it's embryo donation or embryo adoption. And so if you really are just considering the egg donor pathway, a great place to start is your local IVF clinic and where you want to do your cycle. And there are 2 options for you to either do a frozen egg donor cycle, in which you could time it at any point, you know, according to your schedule, because they're frozen eggs. The clinic that you use will help you place that order with World Egg Bank or Egg Donor USA, or some of the other, My Egg Bank is another big one. And you can have those eggs shipped, combine with the sperm source of your choice, and then do a frozen embryo transfer. If you want to use a fresh egg donor, then you have to get the timing right. So it can take a little bit longer for you to find your right match, to make sure that your egg donor is available, to sync up your schedules, but it's completely possible. And there are plenty of people who still do fresh egg donor cycles as well. What's the percentage of in your practice, Serena, that you guys are doing frozen egg donors versus fresh egg donors?
So right now we're doing both. So I definitely tell my patients I have a little bit of a bias towards frozen right now because of the pandemic.
Mm-hmm.
Because I feel like, 25-year-old donors, even if they're really responsible and careful, they still it's still like they could still get COVID. It's
Right.
spreading all over the place, even if they're being really responsible because of these new variants. Like, what if they're more contagious? It's just, and in New Jersey at our center, where we run a full surgery center, and it's governed by the laws of New Jersey, and the Governor Murphy will can't, according to his rules, those patients get canceled. So you could have a donor taking $10,000 worth of
Oh my
meds,
goodness.
and then taking her COVID test 3 days
Right.
before the retrieval, and then be canceled. So that always makes me a little bit nervous. Having said that, we are successfully doing fresh and frozen egg cycles now. We are definitely having a lot of patients also feeling nervous about the COVID policies, and therefore choosing to use the egg banks. And the egg banks
Right.
offer a lot of choices and, good price points,
Mhm.
and the pregnancy rates have been going like gangbusters. So I think we're doing both.
That's great. Okay, that's good to hear. And in terms of where else to start, Shelby, feel free to reach out to the Fertility Answers team on the Fertility Answers app. If you are already a registered user, you would have gotten a text message from us already introducing our fertility advocates to you. They have free text chat support. They can help you find a clinic. They can help you figure out what path you want to go, if you want an egg donor agency or if you want to go with one of the frozen egg banks. So we're here to support you any way we can. Scars for Healing is asking a really relevant question to my life, asking kind of two questions at once. And Scars for Healing, we did address at the top of the hour that women trying to be pregnant in the COVID vaccine, yes, it's recommended. If it's the Pfizer or the Moderna one, it's recommended.
RNA.
Yes, messenger RNA versions. The Johnson & Johnson one is a live virus. We don't think that that's going to be recommended. The messenger RNA.
AstraZeneca also live virus.
Yes.
So probably not for pregnancy for those.
Yeah.
Two.
So there's two companies distributing right now that are messenger RNA. And there have been 10,000 pregnant people who have already been vaccinated with no red flags.
Yeah.
Per
Dr. Fauci, quote unquote.
Yeah. Per Dr.
Fauci.
Fauci. Exactly. Yeah. So that's really exciting. Now, the other thing that she's bringing up that's relevant to me is she's this might pertain to her or to somebody else, breast cancer survivor, estrogen receptor positive. So I think that this is an important thing to talk about because, I did a frozen embryo transfer at my 5-year kind of cancer-free mark, and I was both estrogen and progesterone positive. And, this is something that comes up a lot, of course, which is if you're going to use frozen embryo transfer, you typically have pretty elevated progesterone. If she's going to do a regular egg retrieval, though, you have ways to stim her so that you don't have the estrogen spike.
Yes.
Right?
So we use letrozole typically, which is a breast cancer drug in itself, but we use low doses for a very short period of time. It's really, really good at just dropping the estrogen level and still getting lots of eggs. So that's been really wonderful.
And it's been a game changer for your relationship with oncologists because they used to be afraid of you. They used to be afraid of the whole field of like, well, I don't know. And it sounds scary and I don't want this happening to my patient. So that alone has really opened up the referral pathway for both fertility preservation and IVF after survivorship. So my question back to Scars for Healing is, did you already do fertility preservation? Would this be a frozen embryo transfer? Would this be an egg retrieval? Those are going to have different kind of considerations and timing. And even though I'm 13 years out, I still looped in a new oncologist for a new consult before I'm doing my next frozen embryo transfer.
I think that's a great idea. You can, you can, things change, and it's good to put your team together that's going to be looking out for you. I think that's a great idea.
And also, since I'm old, since I'm old, I also have an MFM. So I do have a maternal fetal medicine specialist as well. And it's not just because I'm a cancer survivor and because I'm heading into my 45th year in the summer, which is crazy. But it is kind of the combination of both.
You're going to do great, but I think that's a wonderful idea as well.
Right. It's going to be great. It's proactive. There's no downside at all. It's super proactive. What do you have there? You look like you're holding up a uterus.
It's like I know.
Oh, it's your ring light. It's your pretty ring light, and it's pink. So it looks like, are you about to illustrate the fallopian tubes to us is what I thought you were about to do.
Yeah. Like I just noticed, like I'm sitting here in the dark and I'm like, whoa, why am I sitting here in the dark when I could be,
all brightly lit. Yes.
Brightly lit. And I said I was going to get a light, and Alice, I'm sure, is like, why isn't she well lit?
I try to match my light to your light, actually, when you're in your home office rather than the office. So I'm glad you have that. It's good. All right, let's see. I know we only have 12 more minutes, you guys, because Serena has to go early today. So I'm going to try to
so many Monday emergencies. It's been like insane.
Yeah, it's been a weird Monday today. I don't know. Is there a full moon? Yeah. Now, laparoscopic surgery for endometriosis and how to weigh the benefit to helping fertility. Like, when do you laser versus when do you just move on to IVF? Because the outcome is going to be the same. Potentially. So, like, how do you make that?
I think if somebody is feeling really uncomfortable, or it's creating, issues like anatomic issues, like very difficult to transfer, very difficult to retrieve eggs, things like that. But we tend to try to avoid surgery and just try to get people pregnant, even if they have severe endometriosis. Some people that surgery cannot be avoided, and they really, they're really suffering, and we can't control it with medications, and they can't get through an IVF cycle without surgery. And those people, really should have surgery. But surgery itself is not as good as IVF at getting people pregnant. It does create a little bit better environment, but surgery for endometriosis can often be very difficult, very tough, and be a little bit risky because endometriosis gets all these organs stuck together. So I tend to try and avoid surgery, because also when you have surgery, even with a good surgeon, you often will have scar tissue created as well.
Right.
And that can cause its own set of symptoms and issues. So I am pretty conservative when it comes to surgery, even with severe endometriosis.
That makes a ton of sense. And so if the endometriosis is causing quality of life issues, severe pain, around period time where it just, you lose days out of your life every single month, would you sometimes try and do an egg retrieval and freeze those eggs before surgery, just so that somebody has a ton of options?
That would be nice, because you can't always do that if somebody's really suffering, but before you have surgery, it would be nice to do that, because endometriosis surgery, you're right, tends to destroy a lot of eggs, even with a good conservative surgeon, because you're often cutting into the ovary, and and the endometriosis and the eggs are kind of all attached together. And so if you're removing the endometriosis, a lot of times you're removing a ton of eggs, and somebody's AMH dropped dramatically. So you're right, it would be nice to get those eggs in the freezer before that type of surgery.
I'm so glad that you hopped on this show, because I know that you asked this question of us today through the fertility advocates that we have helping. This is a really important one, and it's about this endometriosis kind of concern that so many of our audience members has. So she learned recently that her AMH is a 0.08, which in and of by itself, she could see success with IVF, but she has some compounding factors kind of impacting what to do next.
Yeah.
One is that she has bad endometriosis on the right ovary.
Okay.
So it is impacting even kind of visibility. And they weren't even sure about the left ovary because the endometriosis seemingly so bad on the right ovary, they couldn't actually find the left ovary.
Huh.
So
Wow.
yeah, and her husband will likely have about 2 million sperm post-wash, which that's actually plenty for
That's plenty
ICSI.
of sperm.
Yeah,
I'm not
especially
worried about
post-wash. So we're not worried about that. But she was given advice to say, well, you could try IUI for like 2% chance per. And I was like, no, why would you wouldn't,
No,
I would
that sounds
not
like a
waste.
very high risk for ectopic. Yeah.
Yeah, right.
And very low pregnancy rate. Because if
Exactly.
they can, you know, it's like, so I would say if given a choice, we would definitely IVF would be a much better choice, much safer and much more effective. Yeah.
So in this, so I'm not sure who it was where they couldn't actually see the left ovary. What do you do in that circumstance, or does that just immediately trigger your red flag antenna and say, "Oh, let's get a second opinion in somebody who can try again to
Well,
get
you know, if
imaging
you
done?"
stimulate, maybe the ovary is just small because of damage with the endometriosis, and that's
Sure.
why the AMH is so low. So
Right.
it's not totally surprising, and it depends on what part of the cycle. But usually, if you know, even if you can't see an ovary, once you stimulate, usually you can.
You can. Okay, that's good to know.
We don't know. Was this an ovary you couldn't see surgically, or an ovary we couldn't see by ultrasound?
I think by ultrasound, because she hasn't had an HSG yet or anything.
Okay.
Yeah.
So yeah, so I think like a lot of times, especially with a lot of endometriosis and a low AMH, sometimes the ovary's not so visible, but you know,
Right.
usually once you stim, if it's going to produce eggs, usually can find it.
Well, and I think from what I recall from my team talked to me about this case is that they didn't see very many follicles on the right ovary, and so my hope was that the 0.0 AMH is coming from the left ovary.
It's hard to know. Hard to know.
Right.
Yeah.
But definitely faster path, more reasonable with
Yeah, you want to be
spending is just go straight to IVF with all that they're dealing with. Especially, I mean, just the 2 million post wash alone warrants just moving right on to
Right, that's
exceed
true, because
eggs.
that definitely will lead to a much lower, also be a separate contributing factor to IUI, a significantly decreased IUI pregnancy rate. So
Right.
cutting in half. So we're cutting like the IUI pregnancy rate in half and in half again at the very least for both the male factor and the female factor. So
And
now you're down to less than 5%, like maybe a 1% chance.
Right.
It's pretty low, plus a high risk for ectopic, like 15 to 30% risk of ectopic. You know, it's just not a good combo.
Right. The other thing that I would bring up definitely is on the 2 million post wash, like a sperm bank would never be able to sell you sperm for an IUI at 2 million.
Yeah.
Right. So it's just to let you know that there are best practices. Plenty for IVF. Plenty, because they'll just take one good one and inject it right into however many eggs you get. Yeah. So, you know, I think that the question for her is, you know, does she have it in her to maybe try one IVF cycle, because their concern is if they have to go to egg donor cycle. And of course, she's in California where the price was quoted super high. I think we can get the price down by, you know, setting her up with the right, you know, providers. But that's part of the consideration is, you know, if she's at high risk for ending up with an egg donor anyway, you know, should she emotionally try to wrap her head around that now so that, you know, whatever that they can invest, you know, is investing faster towards that outcome.
I think that's really hard, and it's not really for us to say, and everybody is different, and there's so many factors that go into that decision. Some people can, and it makes total sense for them. They're just like, you know, we spend so much time and so much money, and we don't have more resources. We want to throw ourselves into donor egg. This is the way we want to go. And some people really feel like they cannot move on until they try
So they
IVF.
try. Exactly.
You know,
Yeah.
so
If insurance covered it for her, I would say without a doubt, just go ahead and do a cycle of IVF to see how your body responds, and let's get visibility on that left ovary, right?
yeah.
Go ahead and do a stim cycle so that you
Well,
learn.
also, how old? What age are we?
That I
Like,
don't know. Yeah, I think exactly, and that's going to be a big consideration as well.
That's a big consideration. I think what, you know, AMH of 0.08 and you're in your 20s, it seems like you should probably try IVF with your own eggs, maybe even up to 35. When you get
I just
over
don't
35.
understand, why would somebody say IUI or egg donor and not even consider IVF in that mix? I mean, she has to stimulate her uterus if she uses an egg donor. So to me, that
Yeah,
makes
it
no
doesn't.
sense that it's one or the other. It's like either, cheap IUI that is probably not going, that has a 98% chance of not working, or a $50,000 or $40,000 egg donor cycle
Yeah, it
that has
doesn't
great,
really
it's
make
like there's a
sense.
lot in the middle there that she can still, I think that she still has to have a chance to work through. Yeah. So
Yeah, but
Stephanie,
if
we'll
she's
continue to support you on that.
significantly over 40 with a severe endometriosis
Then
and
they
zero,
never would have recommended IUI. Then it would have been unethical to recommend IUI.
you have to think about, you know, going straight to donor egg then, I think.
Right. Agreed. Yeah. Okay. This is all helpful. So QS took letrozole recently. So she's our, was that the breast cancer one? No, that was scarves for somebody. Okay. So let's see. She has PCOS. Her LH is actually low. Her EG3 level has shot to 271, but her LH level is still 5 and below. Do you think the letrozole has worked or will work?
Sounds like it's working. So
Okay.
letrozole is a little tricky. A lot of times you might have to use a trigger shot to actually, you know,
Stimulate
close the deal
ovulation.
for
Yeah.
ovulation.
Okay, so ask that question of your providers. Ask about doing
Maybe doing a trigger shot might be
trigger
helpful.
shot. Cool. Okay. What about cysts in the ovaries? And I see we have to wrap up. She had to stop her IUI this month because of it, Bertita.
Usually those are
A lot.
temporary. That's usually like you take a break from the drugs. Don't take a break from trying to conceive. Your ovulation might be a little bit later, so your cycle might be a little bit longer because of the cysts, but it's just not a good idea to pile drugs on top of cysts. And so you can still try to get pregnant, but take a drug holiday this month, and then they should be gone by next month. It shouldn't be a big deal. But
You see it a
definitely get
lot, right? I mean, it's a pretty common thing.
very, it's one like 20% of the time.
Yeah,
No.
that's pretty high. Okay. Shelby just asking a follow-up question. FSH. So FSH, this is a great way she phrased the question, always. Is it always representative of fertility odds, or is it possible that it's related to something else and can be lowered?
FSH goes up and down and up and down and up and down. And usually your prognosis is based upon your highest FSH, because all estrogen and progesterone and can all falsely lower the FSH. So the highest FSH is usually the most accurate, and definitely it's just not as helpful as AMH. AMH, it seems to be much more reflective of what's really going on with the ovaries.
Got it. Okay, good to know. Steph Leon is going for an HSG tomorrow morning, and she's 34. Just seems like IVF, right? But let's learn what you learned from the HSG, see if your tubes are open, and if maybe there's some better visibility by doing the FSA or by doing the HSG, and then kind of keep us posted, Steph Leon, for next steps. Can we wrap up with just one more question?
Sure.
Okay, great. Because I know you wanted to scoot early. So we have somebody, beautiful brown eyes, cute handle, love that. She had a DNC, and it seems that even though it seems that she's constantly ovulating only from her right ovary, but her right tube was removed. Is it normal to only be ovulating from one ovary? And
usually we think people alternate, but for whatever reason, some people don't alternate, and we don't know why that is. And having ovulation from one side and the tube on the other side, some people think might be an increased risk factor for tubal pregnancy. So you definitely have to be watched carefully for that. And also when you only have one tube, you know, that's, if you're not getting pregnant easily, then that's another reason to think about IVF.
Okay, great. Morgan asked a question that I can answer, which is IVF Barbados. Does IVF Barbados provide, or it's actually Barbados IVF, provide housing and meals? So Barbados IVF has pre-negotiated kind of resort rates at a very affordable price. And then we can work with you on even financing the entire IVF cycle with travel costs.
And
so
Alice
it's all
and I
kind
are
of an inclusive fee.
going to take a vacation to Barbados with no baby making.
I think
right?
I think once I'm vaccinated, let's just have a whole flight of people who want us to chaperone them for their cycles. You don't have to do any egg retrievals at all. You just get to chaperone with me.
All the questions.
We will. Yes, yeah. Exactly. For those of you that we didn't get to the answers today, normally we have a whole hour with Serena. She's really pressed for time today. So it's short. It's okay.
It's a crazy day today. I have to
definitely on. We're so glad you found us too. We're so glad. So just as a reminder for everybody, you know, our relationship with Steph Leon came through the Fertility Answers app. So we're free to use. We bring you these free Q&As with a bunch of experts out there in the field. We have some really cool ones coming up. We do have one with Barbados IVF with Anna, who runs their program there, and she's amazing. So you don't want to miss it. Traveling for IVF, even in the climate, try to say that 10 times in a row. Climate is, and COVID and clomid. I meant to say COVID. If I have been mixing up COVID and clomid since COVID was even a thing. But it really is possible, and it can be very affordable for those of you that are not in a mandated state or those of you who don't have insurance coverage. Serena happens to be practicing in a great state where she does see a lot of insurance coverage for IVF, although not universable, but it is a lot more there.
But we work very hard to make it affordable here.
Exactly. Yeah. And they make it very, very affordable for sure. And also just a very personalized care and attention. But you can come to us at the Fertility Answers app. We have free fertility advocates, free text chat support, free answers to all your questions from board certified professionals, over 400 of them, and also these weekly sessions with Dr. Serena, Dr. Raquel, who's a naturopathic IVF doctor, Dr. Sherry, who's a celebrity OBGYN, Dr. Spitz, who's covering male infertility. And we have some new faces joining us in rotation too, like Anna from Barbados IVF. And Dr. Lucky Seghorn is going to be in the rotation here soon from RMA New York. And she's adorable and smart and vivacious and has her own IVF story to tell in addition to practicing. All right. So beautiful brown eyes. Serena's in Northern New Jersey, but we can help find a clinic anywhere in the world. We'll just make sure that we match you based on what your needs are.
At Fertility Answers, like it truly is like answers to all your questions and your fertility needs. That's what they're there for. So
yeah,
you know, please reach out to them.
All right, Serena, thank you for squeezing us in today. I know it's been hard. Love you. Bye, everybody. We'll see you tomorrow, 4 p.m. Pacific. Bye now.
Bye.